to my channel. I'm here today with a very special guest.
Hello, I'm Sive Gallagher. I'm originally from County Louth, and I now work as a gender confirmation surgeon in the United States in a little state called Indiana. And over the past 5 years or so, I've been doing gender confirmation surgery is my main specialty, and I'm a plastic surgeon over there. And I'm very happy to be here with Jamie to answer some questions.
Yes, so I took to Instagram and I asked you guys to send me in some questions, and you did, mostly about surgery, so we're going to go through them and answer them. So I guess the first question is, how much does it cost?
Right, well, so this really depends. So I've been learning a lot about this week, you know, when I came home, because this was kind of the first time I made a point of looking into how things are in Ireland, because I've been hearing from the transgender community while I'm over there saying, you know, it's great work you're doing in America, but what about us here back home? You know, not everything's available. And, you know, at this point in my career, you know, I'm 12 years over there, and I kind of love to give back, you know, in some sort of way, however way that would look. So I kind of came back and offered my services that way. But anyway, back to how much it costs. So right now the HSE in Ireland will cover the surgery, but it's, and you know a lot more about this than I do, but it's a lengthy process, you know, to get through that, and a very slow process, usually with waiting lists and all the usual things that go along with that. If you want to go, always the option is there to go privately, and a lot of people I'd say are still going abroad for surgeries, and it just depends, you know, it really depends. I'd say in Europe it's a lot cheaper than America, so I can speak to the cost in America. If we're talking about top surgery, you're probably talking in the region of about $8,000, so you do your conversion there, and for bottom surgery we're probably talking anything from about 22,000 to 32,000, so that's a lot, you know, and out of reach for a lot of people. One thing that's very exciting though, it sounds like, you know, because these are medically necessary procedures, we're seeing private insurers in Ireland are going to start rolling it out as well.
Okay.
So VHI and things like that. So, or yeah, it is VHI. It's been gone that long. But yeah, so it, you know, it's not necessarily out of your reach, and I think, you know, my hope is certainly things are going to get a lot more accessible, and people won't be dealing with those ridiculously long waiting lists, you know, because these are medically necessary surgeries, and we know having people in waiting lists with bad dysphoria is not good for you.
No, it's not at all. And especially like here as well, like it's very intrusive. So like if you even want to go for surgery, you have to see a psychiatrist, and I just feel like I just don't agree with that. I just think like when you know, and I don't think it's a decision that you come to it like so like flippantly, you know. It's something you're thinking about for such a long time, and I think when you go and someone tells you like, oh, I genuinely don't think you're ready because of you've got too much going on in your life, which was what was said to me and stuff like that, I just don't agree with that. And I think like I've heard a lot of trans women say like when they were asked about like, do they still get boners and do they still like, you know, all this kind of stuff, and I just think it's so like intrusive, maybe, it's just so intrusive, and I just don't agree with it at all.
Well, so what I would say to that is, because I would say in America we have maybe a better system in a way, because there's no disagreement really about that, because if you're going through insurance, the insurance companies are the gatekeepers to a certain extent. So what we do is how we decide if somebody's ready for surgery in America is, and most of the rest of the world, we rely on the WPATH standards of care. So the WPATH is World Professional Association of Transgender Health, and we have version 7 right now, which it's a set of guidelines, and it's a very easy document to read. You know, if you go online, you just Google WPATH.org. It's a very simple PDF, and it has in there all what we think are the best requirements in order to have your surgery. Now, if anything, these requirements are decreasing every year, because you know, psychologists, psychiatrists are realizing that, you know, patients know what they need and they know what they want, you know. So there's more emphasis on this notion of informed consent, you know, that it's your body and you should do it or what you need. Having said that, right now, you know, when patients come to see me in the States, what they have to go through usually is they have to see one mental health professional. Mental health professional is not a psychiatrist necessarily, and they also have to see one a mental health professional of an MD and or PhD level. So that may be a psychiatrist there, and then a letter from whoever writes their hormones just to say they've been on hormones long enough. So those are the most, kind of stringent, or that's the as far as the extent of gatekeeping goes kind of in the rest of the world. But we're waiting, that's version 7, version 8 has been written right now, so it'll be interesting to see, what changes are in there. So
someone asked, are Thai doctors more skilled at these surgeries, bigger chance of success since they do it more?
Okay, well, so there's no doubt the most surgeries are happening in Southeast Asia, and Thailand, is famous, and there's some big names come from there, and I've never trained over there myself, but I know other people who have, and they definitely get very good results. The only caveat I would say is with going to Thailand is overall in the West, medical care is better. I mean, we know that. And so my only worry and why I wouldn't let a close friend go over there is the what if. What if something bad happens with the anesthesia, or, you get an injury to one of the other structures down there. What happens then? And so for that reason, if it was my sister or whatever, I would encourage you probably to stay, one, closer to home, because it's so far away. So you have that support and family around you, and 2, just what if something was to go wrong, I'd want to know that they have the best care possible.
Yeah. Somebody else asks, so for breast augmentation, in your opinion, is it worth it despite losing sensitivity?
Okay, so I would say out of all the breast augmentations I do for both trans and cis girls, losing sensitivity is kind of down the lists of complaints. It's not too bad, and most girls, if they lose sensitivity, it's temporary. It tends to come back. Now, it may take a few months to come back, because sometimes those nerves, they're slow to grow back in. But I would say for the vast majority of girls, it's kind of a minor complaint. There's lots of different ways to do breast implants, and it can be super confusing, because there's so many options out there, which is the best. Usually what I recommend is, talk to your surgeon. In my case, when I'm choosing how to put the implant in, which incision to use, or whether to go above or below the muscle or whatever, it's a very personalized choice for that girl. And sometimes, I'll strongly recommend them push them in one direction, when I think they'll have the nicest possible result. Or sometimes of a range, they could go either way. But that would be probably my biggest recommendation, is kind of, get personalized care, listen to your surgeon and go from there. But usually overall, a loss of sensitivity is not a big deal.
Perfect. So somebody asks, do you have to be on hormones to be considered for top surgery in Ireland? Okay,
so we'll talk about, when we talk about the girls first. Okay, so for transgender women, I strongly recommend you go on your estrogen for at least a couple of years, actually, because usually we'll see a fair bit of growth, and then it'll plateau off in the first 2 years. So that'd be one thing, and sometimes there's a little bit of tenderness as well as the breasts are growing. And for those reasons, whenever we're doing something in plastic surgery, we don't want the body to be changing during that time, because we want to give you a nice long-term result. So for that reason, it would be nice to have that growth settle down and kind of see where you're at. So that'd be the first point. The second point is, you may not need a breast augmentation. I'm actually doing a breast reduction on a trans girl one of these months now, hopefully coming up, because she had so much growth. And a question I commonly get from the girls is, how much growth can I expect? There's kind of a myth out there, maybe, and I think it's a myth, to be honest. It's you look at your female relatives and you can expect to be a cup size lower than those. But sure, if you look at some sisters, one will have huge breasts and the other have tiny breasts. So I think that's kind of a myth, out there. But what I would say is, getting the hormones, see where you get to with the growth, and then at that point you can figure out if you want to do breast augmentation. So that's for the girls. A quick word for the guys, and for the non-binary patients as well, for top surgery, so the mastectomies. You don't have to be on hormones. Certainly where I work in America, not everybody needs to be on testosterone for their transition, and in recognition of that, WPATH have taken that requirement out years ago.
That's good.
So none of the insurance companies in America will require you to be on testosterone before your top surgery. I'm not so sure about Ireland though, because I think they're kind of still in a binary system a little bit.
I think so.
So I mean, that'll hopefully kind of change over the next while. And in my opinion, sure, testosterone shrinks breast tissue a little bit, But when I'm doing top surgery for the guys, the most important thing is not really the breast tissue, it's the skin. And that skin's never going to shrink. So when you're talking about the two types of top surgery for the guys, you have the keyhole for the very small guys, and then the double mastectomy, or as I call it, the way I do is a masculoplasty. I don't think testosterone's going to make a difference. It's the skin, you know, and testosterone does nothing to shrink the skin, so it's the skin that makes a difference there.
Perfect.
So, yeah.
And I guess that's a good time to touch on, this video is probably directly, or not directly, but mostly for probably trans female people, just because that's like how I am, and I think that was the basis of this video. So obviously we want to include everyone, but it's mostly focused on trans female people. So another person asks, what is the best way to go about breast implants? Is it over or under the muscle?
Okay, so again, this is going back to that thing of you should really get personalized care.
Yes.
Because when I'm making recommendations to a girl about implants, I'm looking at her chest, I'm looking at the size, I'm looking at the position of her pec muscles and all that sort of thing. So having said that, in general, oftentimes for transgender girls, particularly transgender girls who are looking to go kind of 0 to 100, you know, who don't have much there in the first place, I tend to go on top of the muscle for a few reasons. Oftentimes trans girls may have a kind of broader sternum, so their breastbone may be kind of broad, and one thing they oftentimes want is cleavage. So if I'm putting it under the muscle, the muscle inserts in on this broad pec muscle, and I have no choice, I can't bring the breasts any closer. So overall, I tend to more commonly in trans girls put it on top of the muscle, and to use that implant to kind of shape, you know, some girls don't like the way the breasts develop on the hormones. They kind of have a pinched in look at the bottom, so to get that nice roundness at the bottom, I kind of really need that implant to be there, you know, to kind of push out the breast that's there and show it off. So
because I always thought, like, well, for myself, like personally, I always thought I would go under the muscle to make it more natural looking.
Yeah, well, I mean, it depends again, you know, because I always encourage patients to bring me in photographs, because I remember, and actually I have a girl coming up on the schedule who came in and she kept saying natural, and then brought me Baywatch pictures, you know, basically, you know, where you have that like kind of shelf look at the top. So it's really a personal preference. Certainly under the muscle kind of helps mitigate that shelf look, but oftentimes gravity will help that too. You know, and particularly when they settle, you know, one thing about breast augmentation is you don't see your result for about 3 months. You know, they'll ride high and then they'll settle. You know, so definitely don't freak out if you kind of have that shelf look initially. And oftentimes girls come in and say, oh, I miss my shelf.
Oh, really?
Like, yeah, you know, because when things drop down with gravity, but
but that's just the way things go.
Yep.
Okay, so this was a funny question. I don't know if you're able to answer it, but how does it feel to have breasts? I think that was directed at me, but guys, I haven't had any surgery at all. So, I mean, all I know is I have these little bee stings and they hurt sometimes. They're very sensitive. But I like them. I mean, I think they're cute. I mean, I do definitely want surgery, but I guess do you know what it's like to have breast implants, or, you know, have people come back to you and said, oh, whatever?
Yeah. I mean, so I don't personally have them either. Full disclosure. But it tends to, you know, it's one of these things. It helps some girls a lot. You know, just feel more comfortable in their skin and the clothes fit better. And of all the surgeries I do, it's not a big one for recovery. Patients tend to get over pretty quickly, and I would say satisfaction rates are very high, very high. Yeah, and it does. I firmly believe it definitely helps with dysphoria. There's no question. You know. So. Yeah,
absolutely. Like, I think before I started to develop anything, I was like so self-conscious about my chest. Like, I would never wear anything that was like low cut or anything like that. But now that I have a bit of something there that I can kind of like push up and make cleavage and stuff, like, I feel so much more comfortable. I can wear kind of most tops, most dresses. So yeah, absolutely, I agree. So this question I've heard definitely before. It's, do you recommend doing breasts and gender confirmation surgery at the same time?
Okay, so I don't do it in my practice just because I think it's a little bit too much. Some surgeons will do it, but, you know, for bottom surgery for the girls, vaginoplasty, full vaginoplasty usually takes me about 4 or 5 hours at least. And then on top of that, the breasts, you know, usually take me between an hour and 90 minutes. So I just think it's a lot. One, it's a lot to recover from. And we know from other studies, there's never been a scientific study done in this particular group of patients, but in other studies we know the number of procedures, higher the number of procedures, the more likely you are to get a complication. So I personally just don't think it's worth it, because it's two completely different parts of the body and two things to deal with. Some people do because they're trying to decrease their time off work and that sort of thing, but compared to bottom surgery, top surgery is so easy, and there's not too much downtime with it. The other thing as well is when you're doing bottom surgery, vaginoplasty, it's kind of a dirty procedure, kind of, just because we classify procedures as to how much bacteria is around. And so there's a lot of bacteria around when we're doing that, and there really should be very little bacteria when we're doing breast implants. So there's evidence to show that maybe if there's a lot of bacteria around, you might get into trouble down the line with capsular contracture and all sorts of things like that. So just for those reasons, I don't combine the two. The only thing I have been talked into with a few patients is doing a zero depth procedure. So that would be in some patients, about 15 to 20% of my patients don't feel the need to have a vaginal canal created. They're not going to use it, they don't want the risk from it. So what we do is we feminize everything on the outside. And you can't tell the difference from the outside, so that's what we call like the zero depth procedure. So in that case, I may do that procedure and breast implants at the same time. But overall, I generally steer patients away from that.
So for breast augmentation or top surgery, how long is the healing process?
So it's usually not too bad. It tends to be, I always say healing is a very personal thing. And it's not that, some people are wimpy or whatever, just some people seem to have more pain receptors or seem to just feel it more, So I think maybe if it depends, if a girl's going very big, if a girl's going kind of 0 to 100, obviously the more kind of tissues being rearranged and that sort of thing, so it may take a little bit longer. But in general, most of our girls are back to work in a week. And so not working out upper body stuff for 6 weeks. And we put you in a surgical bra, which is just kind of almost like a snug kind of sports bra. That's it. And we encourage you to wear that for the first while to give a little bit of support, but you can come out of it. So it's not too restrictive. I would say the people who notice the recovery most are the people who live in the gym. And do a lot of upper body stuff, because they're going to have to quit that for at least 6 weeks.
And for top surgery for guys, is it the same?
Yeah, pretty much for the guys. So top surgery for the guys, and I should mention top surgery is always outpatient. Pretty much, with very few exceptions. You come into the hospital in the morning, go home that afternoon. And so mostly the guys are off about 2 weeks. They're off a little bit longer, and they're dealing with the nipple grafts, because the nipples come off and go back on again, and they can't do any heavy lifting or working out for 6 weeks. So
I really liked this question, just for people who would be like supporting a trans person or would be taking care of them after surgery. So someone asks, best way to help trans folks during recovery post-surgery?
I love this question. This is a really good question. So what I always say, before surgery, readiness for surgery, like bottom surgery, is a big deal. And you have to have a few things in order before you go through with it, because we're creating something new, we're creating a new vagina, and you have to look after it, particularly in the first few weeks after surgery. So most girls are going to have to be off at work for about 6 weeks, so you really need your people. So you're going to need support. You're not going to be an invalid. You're not going to need somebody to bring you to the bathroom or whatever. You're going to be able to do that yourself, but you need somebody to drive you to your appointments. And particularly if you're going somewhere far away, of course, which a lot of people have to do, you really just need to bring somebody with you. You're not going to be okay going abroad by yourself, because you're going to be on pain medicines and that sort of thing. So having your buddy is critical. So somebody's going to need to be with you the first few nights after you get out of the hospital, and just kind of having a helping hand. And if you are a friend who's not necessarily the buddy, not necessarily the close person, keep in mind surgery can be really rough emotionally on multiple levels. And I always say it doesn't matter what surgery you're having, but particularly the gender confirmation surgery and particularly bottom surgery can really be a roller coaster. So being there to listen, to your friend who's going through it, who might just want to sit down and have a cry or something like that, because it's really rough, and I think there's a few reasons it's very rough on girls. One, you got the emotional roller coaster, you know, so oftentimes your hormones are held before surgery, so you're feeling completely yucky, and then we remove the testicles, so then the hormones are all over the place like fluxing all around, so you know, makes you kind of teary anyway. And then on top of that, another few things come into it, because you know, a lot of girls have to work so hard to get there, and then afterwards there's always this feeling, because it looks terrible at first, it always does, it looks like a nightmare. It looks like a bomb went off always, and just know that that's normal, you know, it never looks good. And girls are always looking at me because they'll come back into the office and I'll be like, you look great, you know, because I know it's going to heal great, and they're like, are you kidding me? But you know, so it can be oftentimes at the end of that long struggle, you know, and you've worked so hard to get there, and then you're looking at this and you're like, what have I done? You know, and I think it's almost, from my girlfriends who are trans, I feel, and you know, the girls who've done surgery, I feel like the feeling of what have I done is normal. You know, it's almost to be expected. It's probably gonna hit you at some point on some level, you know, and then you got some pain on top of that. So just, you know, to know as a supportive friend, this can be really rough, which seems counterintuitive. And I had a hard time initially when I was a surgeon. I had a hard time, you know, because like girls were coming into me and they're, you know, working so hard to get here, and then I do the surgery. I'm like, ta-da! Now you're better, right? And they're like, no, like not at all.
Not for a while.
Yeah, not for a while. You know. So just know that the recovery from this surgery is long, and you know, if like a lot of my girls who are young patients, you know, and haven't had major surgery before, it lands you on your ass, like nothing has ever done to you before, you know. So they kind of, maybe because when you're young you're tough, you know, and you think, sure, I'm fit and healthy, I'll walk through this. Nah, you just, you know, and just in the weeks after surgery, for at least 2 months after surgery, you're going to feel absolutely gross. You're just going to feel disgusting. So all those things, you know, they can be really good to know, to be a supportive friend.
Good question. Thank you.
Great question.
So I think a major question that people have is, and same as me, like, can you die from having gender confirmation surgery?
Okay, so I would say the first thing I'll just put out there is you can die, unfortunately, from any surgery. When you go under anaesthetic, you know, it's like the risk you take when you get into your car. And oftentimes our anaesthesiologists, I haven't looked into it myself, but oftentimes I'll hear them saying to patients, well, the car drive here to the hospital today was the most dangerous thing. So, you know, general anaesthetic is very safe in this day and age. But like a car accident, it can always happen, okay? But a young and fit and healthy girl, you know, really the chances are extremely low, you know, that would happen. There are things that can go wrong, and there's kind of bumps in the road and that sort of thing. I would say the one thing, every girl coming into surgery, obviously she needs the surgery, it's a medically necessary procedure, but you kind of have to know what you're getting yourself into, you know. So we don't tell patients the horror stories to scare them. I kind of hate that, you know, kind of putting that in their head for them to be keeping up at night. But it is, on the other hand, good to know kind of what you're signing up for. So what I would say, if we're talking about vaginoplasty, the biggest risk really from vaginoplasty is when we're doing the surgery and we're rearranging things down there and creating a vaginal canal where there wasn't one before, it is possible that other things can get injured down there. So if you're thinking, you know, what could get injured, you have your bladder up on top and you have your rectum below where you poop from basically. So kind of the worst case scenario is getting injury to that rectum where you poop from. So the chances of that happening are pretty low. Touch wood, I haven't had one in a vaginoplasty, but we reckon it's probably about 1%. Now, if that were to happen, in order to let everything heal, the kind of very worst case scenario would be you might have to get a temporary bag, okay, on your belly, okay, to let everything heal below. It should be temporary, but you know, obviously that can be very disruptive to somebody. So as a surgeon, to me, one of the kind of worst case scenarios is having to do another surgery unexpected. You know, so one of the things we do get from time to time, and it's about 1 to 2%, is where you urinate from, where we make the new urethra, where you pee from, it may narrow down and we may have to unexpectedly you know, do a surgery to open that up. So those are kind of the biggest risks, I would say, after doing this. when I talked to a girl about getting vaginoplasty, this surgery originally was designed as a 2-step process, 2 different surgeries, and we can get you almost all of the way there. We can get you about 90% of the way there, and I always try to get you as far as possible, or to get you the most natural result possible at the first surgery, but knowing that when everything's healed in about 9 months' time, we may want to come back and do a bit of a nip tuck. Nothing nearly as invasive as the first surgery, but just, you know, a labiaplasty. So labiaplasty is kind of an umbrella term. It's whatever sort of nip tuck you need to help improve the appearance of things down the line after it's healed. So I always kind of put that out there. We tried to make it as good as possible at the first surgery, but we may want to kind of adjust things a little bit down the road to make it look better. So just to know about that. But the original question was, could I die from having this surgery? In theory, yes. You know, could you die from getting in your car and driving down the road? Of course. You know, so, but it's very, very safe. As surgeries go, it would be extremely unlikely, extremely rare. You know, we're talking almost plane crash rare to go to sleep and not wake up.
Yeah,
You know,
I think that's my worst fear is the anesthetic. Like I believe that if I go for surgery, like I'll trust my surgeon so much, but I think it's the fact I don't know how my body will react on, you know, under general anesthetic. You know?
Yeah. Well, what I would say to that is it's extremely safe, and you know, particularly I can speak to the United States, and I know because I practice here in Ireland as well. Ireland's very safe. You know, like these guys know their stuff, and you have an anesthesiologist, and that's basically all they do. You know, they're complete experts at this. And recently, actually, in America, I had a young guy who had a bad reaction to one of the drugs, and to see these guys in action was like awe-inspiring. My mind was blown. Like it was like the Grim Reaper showed up and they like just kicked him out. They're like, absolutely not, you know. So it's you know, like they had him everything under control within seconds. You know, so I would say, and I can speak, you know, personally, I used to be very nervous about getting surgery myself, but having seen so many over the years, I had to have surgery in January, and not a problem. I wasn't worried.
Okay.
So, yeah.
So, moving on, somebody asks, I have a friend who told me that they were trans. How can I help them understand the surgery better?
Okay, so I think this is a great question. We were kind of saying a lot of people, they equate to, you know, transitioning to going to get the surgery. And I would say that's maybe a bit of a misconception. The surgery tends to be one of the last things you do. You know?
If it's any step in your transition,
Absolutely.
because
Yeah,
you
it's
don't
not
have
for-
to
Yeah,
medically transition.
Exactly. You don't have to medically transition, you don't have to surgically transition. This is very much a personal thing. You know, and 100%, you know, working in this field, my patients have taught me it's patient-centered care.
Yes.
It's individualized care. You know, it's definitely not one size fits all. So surgery may not even be on the agenda at all.
And it doesn't make you any less trans as well. Let's just put that out.
Yeah, for sure. And, you know, but if you are interested in getting surgery, you know, it has to be a well thought out, because there's lots of different options as well, you know, and you have to just sort of figure out, and you would know more about this process than me, you know, what's right for you and which of the options is right for you. And what I would say, the other encouraging thing is that things are getting better all the time for the community with regards availability of services. So, you know, I can speak to the state I work in America. You know, when I showed up a few years back, there was nobody there doing that. There's never been anybody there, and now, to the other extreme, we have the Medicaid, which is a socialized medicine over there, paying for the procedures, which is fabulous, you know, in a very conservative state. You know, so things are getting better, and they're getting better rapidly, you know, because people realize these are medically necessary procedures.
Yeah, and I think if your friend does come out as trans, and, you know, I think the best thing is just to be there for them every kind of step of the way. I think surgery is something that will happen, if it does happen, it'll happen quite a bit down the line. But I think, as we've touched on before, it's just about supporting your friend when they go through surgery, because it can be such a scary time, and just to be there for them. And, you know, they'll have done their research, so it's not about you helping them understand it better. It's more just you being there. And, you know, I think it's great if friends or family want to go and research the surgery, you know, look at YouTube videos, or, you know, even go onto Dr. Saib Gallagher's YouTube and learn about it, so that, you know, you can be there to discuss it with them in that sense, you know. Yeah. What would be the most common misconceptions about gender confirmation surgery?
Okay, so this is a great question. So I would say maybe one of the most common misconceptions are that, you know, people, that there's, certainly among cisgender people, is that there's a lot of regret You know, that's very common. We know from the literature that it's extremely rare and less than 1%, and certainly in my practice would reflect that it's extremely rare. So that's probably one of the most common misconceptions. The second one probably would be a lot of people who aren't familiar with the needs and struggles of the transgender community and gender dysphoria would sort of think these are almost like cosmetic procedures, you know, that people just, but what we now understand in the medical community is they're medically necessary procedures, and there's been a lot of studies done on this that basically if gender dysphoria is not treated, it's life-threatening, you know, in many cases. And the amount of suffering from that is immense. The other thing is a lot of people who aren't familiar with gender dysphoria will be really worried to say, well, what's this going to do to the taxpayer? You know, am I going to have to pay for somebody else's surgery? And what we do know is that it's actually cost effective. Not only is it the right thing to do, you know, obviously to stop, you know, give patients medical care, you know, it's the right thing to do. But on top of that, it's actually economically the right thing to do, because you're going to save money potentially in the long run. Because rather than, let's say, a transgender person who's suffering away with gender dysphoria and all the problems that causes in their life, with, you know, suicide attempts, showing up in the middle of the night to the emergency room for a healthcare system, that's extremely expensive. It's a disaster, just economically, well as obviously for the poor patient. But, you know, so we now understand that if you pay for the surgeries are not very expensive. You know, as surgeries go, they're not very expensive. And so if you pay one time for the surgery or the hormones are cheap, very cheap. So if a healthcare system pays for that, they're going to save money in the long run. And besides, it's the right thing to do. You know, looking after the patient, you know, surprise. So,
That's bigots for you, always thinking about their money. This question, I didn't really know if I wanted to, like, answer, but I suppose I'll just leave you kind of answer. But the question is, will you still get a boner, or would it function like a vagina and get wet and stuff?
Okay, so this is actually a good question, whether or not it was meant to be one or not, but it's a pretty good question. So I would say when I do vaginoplasty, my first job is to preserve all the nerves. Okay, so all your sensitivity, and it's amazing surgery. As a surgeon, I absolutely love doing it because you get to kind of see all the parts when you're in there and you sort of disassemble the penis at first. So what we're going to really want to do is preserve those nerves going to the head of the penis, which is then going to become our new clitoris. Okay, so you should be able to orgasm afterwards. Now, you know, you'd be feeling like crap initially in the first few weeks and months after surgery, but every single one of my girls who has wanted to have an orgasm has eventually been able to have one. You know, obviously some people are asexual, and that's grand. But for the ones who've wanted to have an orgasm, they've been able to do that. And so that's mainly preserving the nerves to the new clitoris. So we do clear out the vast majority of that erectile tissue. So getting a boner doesn't really happen, but there is a little bit of erectile tissue around the new clitoris, just like in any girl. You know, there's erectile tissue, so that will enlarge during, you know, when you get aroused. But, you know, as any clitoris would. Does it get wet? So this is there's different techniques in making vaginas, but the most common way to make a vagina is to use some of that penile skin, so to turn the penile skin kind of inside out. So it's called a penile inversion technique, and that would be the most common way to do it. And oftentimes we use some scrotal skin as well. So that skin never turns into kind of wet mucosa, you know, like vaginal mucosa. But having said that, some girls will get wet when they get aroused, because what we do leave behind are these little glands along the urethra. Which stays there. Most of the urethra stays there, and basically the glands that produce the pre-ejaculate or the precum are still there. So it just really depends on the individual, because it's highly variable. Some girls don't produce any, some girls produce quite a bit. You know, so that's where you would still probably get a little bit of lubrication from. However, most girls use lube, and you know, most cis girls probably should use lube as well. You know, so when having intercourse, so it's you know, very common if you want to make it, you know, comfortable for everybody. You know, lube is usually your best friend.
Lube it up. So I think a major thing that when I was like looking up GRS and all this kind of stuff, or GCS, whatever, was dilating. And I think like, I don't know, like, I've heard that you have to dilate for the rest of your life. Is that true?
Yeah. Well, so the thing is, when you create this new vaginal canal, your body's very good at healing, and it's always going to want to try and heal that canal down shut. Okay. So in the first few weeks after surgery, well, for what we do, first of all, during the surgery, we put a packing in there, and that packing stays in there. In my patients, it stays in for a week. Okay. So they come back in a week, the packing comes out, and then they start learning how to dilate. And so dilation, yeah, it probably is a lifelong commitment. Now, it depends. I certainly have friends and I have patients who say, I don't have to dilate anymore. And that may be true, but I'm not too sure about that. I wouldn't bank on that.
Yeah.
And then the other thing is, if you're having penetrative sex, that counts as a dilation. So, you know, if you're having that regularly, that obviously counts as well. But usually for the long term, after the first year, you're doing it probably about 3 times a week.
Okay.
Now, I've found a little bit of variation in my patients. You know, some girls will sort of say, you know, in the first few months after surgery, well, listen, I have been busy at work and I've been kind of dilating a few times a week, and they're wide open, they're grand. Whereas other girls have had a tougher time.
Yeah.
You know, so there's a little bit of an individualized thing there. But at first, you know, that's what you're doing in the first 6 weeks after surgeries. You know, recovering is mainly, you know, learning how to dilate and learn how to use it. And we're pretty hard on our patients. We make them do it 5 times a day initially when they're home from work, you know, when they're off work recovering. And, you know, dilation, a lot of mystery about it. There's not too much to it. You know, you kind of sit down somewhere comfy, like a lot of girls use the bed or whatever, and you put this dilator in, and there's different sizes your doctor will give to you, and it's very easy to do. There's not too much mystery about it. There's not many mistakes you can make, but you put it in and you hold a bit of back pressure on it, usually for about 15 minutes or less.
Okay.
You know, and that's your dilation. And you know, girls will just incorporate it into it, so it becomes like kind of brushing your teeth. You know,
Yeah.
it just gets into the routine.
Cool.
So yeah.
And I suppose a question that I have personally is, when I have bottom surgery, I suppose like when I have bottom surgery, when I have top surgery, and I'm not saying you have to have surgery to be female or to be whatever, you know, I still feel 100% female right now, but I'm just saying that if I go and I have, like, say, a one-night stand with someone, or if I go and have, like, sex with someone, like, will they know the difference? Like, will they know that I've had surgery down there?
Yeah. So, I mean, that's a great question. So, I would say my kind of textbook answer or whatever for safety is you should always disclose it. But that's hard to apply, and I won't speak to that as a cisgender girl. You know, I don't have any expertise in that. But I would say it's probably possible to pass once everything is healed. And you know, I have patients who haven't disclosed it to their doctor, who've done an exam and passed, which I certainly wouldn't recommend, you know, because your doctor has to know what's going on,
yes,
you know.
of course.
So, I mean, it is possible. I kind of recommend against it, you know, particularly at first, you know, before you're used to using the new vagina, because it's a whole new thing you kind of have to learn, and you have to be comfortable with it. And a lot of girls, you know, when they're having sex in with their boyfriend or whatever, in the first few months, they'll incorporate dilation in, you know, to make sure they're comfortable and they're relaxed, you know, before having intercourse. Now, having said that, I'll bring this in as well, is one thing that's very useful, is there's these amazing people called pelvic floor physical therapists. Now, when I was doing these surgeries at first and kind of helping girls through having sex initially and that sort of thing, I have a certain amount of expertise. I know the anatomy down there, but these girls, these pelvic floor physical therapists are fantastic, you know, because it's what they do, you know, it's their expertise. And the new vagina goes through the pelvic floor, which is a wall of muscle, and oftentimes they can teach girls, if they're having some difficulty, how to relax that pelvic floor, you know, and it's like Kegel exercises kind of on steroids, you know. So I would definitely say pelvic floor physical therapy, most of our patients will do at least one session afterwards, and it can be super helpful. But yeah, that's a great question.
Would you recommend people to go to your practice? Like,
yeah, well, so I would say for Irish people, it's expensive. The United States, I mean, just medical procedures over there are so expensive. If you're in the United States, by all means, please come and see me. I'd be delighted to have you as a patient. But for girls over here in Ireland, it's expensive, and we're talking probably, you know, 22 to 32,000, somewhere in there, you know, which is way out of reach for most people, obviously. But what I would say about traveling is I get about 40 to 50% of my patients are from out of state. You know, so it's something we figured out how to be able to manage that when you're flying in for your surgery. You usually have to stick around at least 8 days, and then it's always good to have a doctor back home who can help you out, and that can be a GP, or it could be your gynecologist, or it could be another surgeon, and we'll liaise with them if they have any questions. They can, you know, they can send me pictures or whatever. So traveling, I would say it's a necessary evil for a lot of girls. In an ideal world, you'd be able to go, you know, to your local hospital, but obviously that's kind of a dream right now.
I'm not even sure they do it here in Ireland.
They don't do bottom surgery here in Ireland. I've offered my services, and we'll see, you know, so hopefully things will get better in the next couple of years. And
fingers crossed.
Yeah, and I mean, I'd love to, you know, get the waiting list down, or maybe, you know, train somebody, or however that looks like. So I was going to do my homework and register here in Ireland. So
because I think they're sending people over to the UK, which isn't too bad, I suppose, but it would still be nice to kind of do it at home. Okay, everyone, so that is the end of this video. I know it's been very long, but hopefully it's been very educational for you. If you want to know more about any surgeries, I would definitely recommend going on to Dr. Saiv's YouTube channel, and I will leave the link to that in the description below. And we have also done a video on her channel, so definitely go and check that out too. And until next time, thanks for watching.
Bye.
Hope you guys are staying happy and healthy. Wishing you a fabulous and safe day.